Well, good morning, although it's nearly afternoon, isn't it? And it is Saturday, and we're very mindful of that. It's a pleasure to welcome you here in Birmingham for us as well. It's great to see you to hear. Now, our talk is really quite a different one from Martin's, in that what Faith has asked us to do is actually start to talk about something that's actually quite controversial for us. For anyone who has turned the TV on since Christmas, for many of us within health, we've been living this for probably 3 years. It's probably the most important, crucial time for us, and some of us are saying that we've had through our career, by a publication of a report that we know of as the Francis Inquiry, which was carried out in 2 phases and has been very highly publicised, has involved both people at Mid-Staffordshire, has involved families very significantly, but also has involved many of our bodies such as the GMC and the Royal College of Nursing, who have had to come and give evidence in respect of their involvement in this public inquiry. So what our aim today is to actually say, okay, this is awful what has happened to those families. What is it that we are doing to get this onto the agenda? And for many people, and actually even our colleagues have said, but that happened in Mid-Staffordshire. So, you know, this is, for us, we're at Birmingham Children's Hospital. How would this apply? Is actually to say, well, actually, what we've learned is not just about one hospital. It's about how we provide care, how we can provide empathy, how we are coming across, but very importantly, how we are listening to patients and their relatives, and learning from that experience and putting that experience back into knowing how care should be provided. So overall, just to give you a brief, and there's no way in 20 minutes we can go into the report into Mid-Staffordshire. It's there on the internet. You put Mid-Staffordshire in and it comes up, and it has 219 recommendations that trusts, actually every trust is being asked to say, how are you going to respond to these recommendations? And the recommendations are extremely broad, but our aim actually is to start to say, so here, how can we interact together, that partnership between relatives, patients and the professionals, to say, going forward, this is what it starts to look at. So the important thing from Mid-Staffordshire, and there's been many, and I'm sure many of you will know, we had a Bristol inquiry that came out, which was looking at children's services. There was the Alder Hay inquiry. They're all out there and have hit the media. The really difference here is the way that the relatives got behind telling their story. And Francis was actually really, that was the big thing for this inquiry, was actually what was the story of the patients, but also of the staff within Mid-Staffordshire. Also, it was about what the themes have come out, and the recommendations are really saying to us, it's about patients, not about numbers. Because if many of you are familiar with it, one of the big things that they said is the hospital became very hooked up on targets, numbers, what they were doing about that, and actually the patient stories got lost within that. So actually, how can the boards of hospitals very much keep that in their mind going forward? It's also not about the systems within the hospitals that were put into place, but the staff within those systems and how they are reporting and telling their concerns if care is not being provided as they feel it should be. And actually, very importantly, overall, it was about how services can be improved and not about cost improvements. That's a real challenge in the NHS at this moment in time, particularly with the financial position that you will know when you turn on the TV. But the really important bit, and I think we are hearing within trusts, is this review is not going to go away. It will not pass unnoticed, and actually thanks to the friends and the families of Mid-Staffordshire, we're continuing to hear that on a regular basis. Now I have to say I have pinched this slide and the story that goes behind this slide, as my chief nurse actually went and met Francis and actually said to him, okay, what is it overall here that you felt in a sentence you could say? And he shows this slide, and this slide was presented to a group of surgeons and a group of radiotherapists and said, what do you see? And of course these people do detail, real detail here, and they said, oh well, I can see that this here and this here. And he said, but can you see, and I'm not sure you can see it clearly, the gorilla? And wasn't until it got pointed out, thank you, that actually the gorilla became evident. And I went, oh yes. So actually the big issue with from the Francis is what they're calling unintentional blindness. How can we start to see the warning signs? And actually when we are very medically led, very focused on protocols, etc., what is it like for the child within the experience? Because that's the thing that we really are needing to see and learn from. For nursing, the big area that we're going forward, you may well be familiar with it, or if not, if you go on to Mid-Staffordshire, you'll start to see our strategy going forward for the UK is about the 6 C's of nursing. Those 6 C's are what are guiding trusts in saying, how can we start to really make sure we're providing compassionate care? It's not to say we're not providing it, but actually how can it be improved? The incident actually within a very busy oncology unit, and I've heard these stories from our families and maybe from yourselves, is that the nurses are extremely busy, the doctors are extremely busy, but actually even with the busyness, how do we get down to that child's level or to your level and actually be able to say, you know, the smile on the face when there's such a lot going on? And so overall, the recommendations that have come out of Mid-Staffordshire that trusts are looking at is, how can we look at the culture? So what is the culture and the modernisation of that culture that we need to consider? We need to be setting standards that are easily understood and accepted with our families involved, so that they can be part of telling us how those standards need to start to look at. The openness, transparency and candour, and the word candour has really come on to the scene following Francis, and that is, if you have a concern, how can we take that concern forward, really importantly. So the complaint process, is it really working? Because some would argue in Mid-Staffordshire it didn't, and certainly many of those families say we put our concerns forward but they were not heard, it took a long time for us to get a response back again, etc. So how is it that the nurses also, or the doctors or the allied health professionals, can raise concerns within the areas? And actually importantly, fostering that passionate, dedicated staff. What was also very interesting is there was a study carried out last year, because people were very concerned where the NHS was sitting. And actually last year was an interesting year in the UK, because we had the Olympics, there was quite a lot going on with regards to armed forces. But this Murray study actually said, what was it that makes you proud to be British? And for us, actually, with Mid-Staffordshire happening as well, people were still saying the thing that they're proud most of is our NHS. So what we'd like to do is show you a video before we go on and actually translate it into what we've got in practice at the moment for our paediatric oncology and haematology services. This video comes from the States, so I think we do need to be aware it's a slightly different culture, but I'll let it speak for itself and see what you think.